presentation was given at the Summit on National Guidelines Planning Committee meeting in regards to national guidelines for culturally and linguistically appropriate healthcare services in HIV for ethnic and gender minority communities. Native American lifeways are what make Native American peoples different from mainstream society. The use of the S on peoples indicates nation-states and represents over 500 Native American nations. Each nation has their own values, customs, spiritual practices, and native lands. Spiritual practices among Native nations may appear to be similar based on region. Some spiritual practices may include aspects of Christianity that have been incorporated, and some may not. It depends on time of European contact. Indigenous language is very important in understanding values, how to address a person, and the relationship between people, otherwise known as kinship. European contact created changes in how indigenous languages are spoken. Original dialects are often referred to as the Old Language, meaning before European contact. Due to the impact on our languages by European contact, some very important information contained in the Old Language has been lost or is spoken only by the elders or traditional people. When working in Native communities, it is a good idea to work with a person who knows the local indigenous language or who knows a fluent speaker who can assist you with your terminology in order to maintain maximum communication. For example, in Dakota Lakota language, the word winkte indicates a two-spirited male. He is male, yet behaves like a woman. There is no derogatory meaning attached. Many indigenous nations have words with similar meaning. However, because we are all not of the same nation or dialect, the word two-spirited has become a pan-Indian word, which has a universal meaning when used in reference to the LGBTQ community. It is also important to know the cultural values and language within the community, as not all nations have an acceptance of the two-spirited within their history. In this instance, it is best to work with a two-spirited person to find out how to address the community. You may need a translator that knows the local language to assist you with those that are more comfortable speaking their own language. If a translator is utilized in a workshop, make sure they have an understanding of and compassion for those who are HIV positive. Keep in mind that there is a long history of diseases that have been introduced into indigenous communities by colonizing governments as a way to reduce populations and as official genocide plans of action. These include smallpox, yellow fever, and tuberculosis. When working in indigenous communities, work with a local indigenous person if you are from the outside. Make sure to be respectful of all age groups. Having support from the elders will greatly assist in successful educational efforts. There are communities that have not received much prevention or awareness education on HIV. These are the most challenging communities to work in. Be sure to share information regarding women and HIV. Women as a group are experiencing infection at the highest rate. Indigenous communities are often small, everyone tends to know everyone, and there is often a fear of gossip. As such, maintaining confidentiality is critical. If confidentiality is breached in a small community, the information is known very quickly. Suggest to the local Indian Health Service hospital or clinic to make sure that testing is as inconspicuous as possible. Make sure they do not have the HIV testing kit labeled so that others can see it being carried to a room. People may be reluctant to get testing at the local Indian Health Service facility because they fear a breach of confidentiality. Identify off-reservation testing sites so people have a choice. Fear of confidentiality violations will prevent a person from early HIV testing. Resources are limited, so find ways of providing transportation to access alternative testing sites. Understand the importance of family to Indigenous peoples. A person may need assistance with informing their family about their HIV status. They may be afraid how their HIV status will be handled within their community, and they may not want their family to know that they are HIV positive. Do not assume that a person has the resources to travel for medical appointments. Indigenous peoples are humble and find it difficult to ask for assistance. Do what you can to make sure they are aware of and have access to all services available within the community, including transportation, Meals on Wheels, and public health nurses. Be an advocate for a person with HIV. There are still some medical personnel within our Indian Health Service facilities that do not want to work with HIV-positive individuals. Do not hesitate to report a staff person for unacceptable behavior to the local IHS director. It is very important to remember that the healthcare provider at the local IHS may not have much experience working with people with AIDS. It would be in everyone's best interest to provide updated information on treatment and medications. These are some of the main points to remember when doing HIV work within Indigenous communities. You may want to add to this list and share it with others. By doing so, HIV cultural incompetence within Native American communities can be avoided.